Interviewing for painful menstrual periods, case history. A 15-year-old girl had been suffering from severe abdominal pain for just over a year, beginning 18 months after menarche. The pain was on the right side of her abdomen, and she described it as a continuous dull ache. However, it would become sharp and stabbing during her period and also at other times. The pain was relieved by the application of heat. 3 months before she came for treatment, the patient had an ovarian cyst removed from her left side, and one on her right side had been drained. She also had recurrent attacks of oral and genital ulcers since the age of 9. These had been relieved by treatment with steroids. On questioning, the patient revealed that she was prone to constipation, specifically that she had infrequent bowel actions. Her tongue body was swollen and slightly red on the sides. It had a white sticky coating, particularly in the gallbladder area, and was peeled in the center. Her pulse was wiry on the right and slightly wiry on the left, where it was also empty at the deep level. The stabbing nature of the abdominal pain, together with its alleviation by the application of heat, seems to suggest cold in the uterus as the main cause. The abdominal pain began shortly after menarche, which also would suggest the presence of cold in the uterus, as this is a very common pathogenic factor in young girls suffering from dysmenorrhea. The wiry quality of the pulse seems also to confirm the presence of stagnation. However, this initial hypothesis is not confirmed by the other clinical manifestations. Ovarian cysts are usually characterized by dampness, which is the case in this patient, as the presence of dampness is confirmed by the swelling of the tongue and the sticky coating. The recurrent oral and genital ulcers are caused by damp heat in the girdle and directing vessels. A disharmony of the girdle vessel is a frequent cause of the accumulation of dampness in the genital system, especially in women. A disharmony of this vessel is confirmed by the distribution of the tongue coating in the gallbladder areas. This disharmony of the directing vessel is shown clearly by the distribution of oral and genital ulcers, as this vessel starts from REN1, flows through the external genitalia and on the face, wraps around the mouth. In this case, dampness is combined with heat, which is evident from the redness of the sides of the tongue. Therefore, we can conclude that the abdominal pain is caused by damp heat and not by cold, as it would appear on first impression. The long-standing retention of dampness in the lower burner, it started when she was 9, also led to chi and blood stasis, and therefore the aggravation of the pain during the period. From a Western medicine point of view, recurrent oral and genital ulcers, which are inflammatory and non-infectious, are known as Behçet's disease. The peeling of the central area of the tongue indicates stomachache deficiency, which was probably caused by heat injuring yin. The pulse being empty at the deep level confirms the yin deficiency. However, it is empty on the left side rather than the right side, as would be expected in stomachache deficiency. And this may be due to a deficiency of liver yin. This is all the more likely owing to the disharmony of the girdle vessel, which affects the gallbladder and liver channels. Thank you for your attention.